Lymphatic filariasis, wuchereriasis and brugiasis. Lymphatic filariasis is caused by the worms Wuchereria bancrofti, Brugia malai and Brugia timuri. These worms occupy the lymphatic system, including the lymph nodes, and in chronic cases these worms lead to the disease elephantiasis. The adult roundworms that cause lymphatic filariasis live in human lymph vessels, but their offspring, called microfilaria, live in the bloodstream. Mosquitoes become infected with the larvae when they bite infected human hosts. They pass the worms to other human hosts as they feed. Lymphatic filariasis affects over 120 million people in 80 countries throughout the tropics and subtropics of Asia, Africa, the Western Pacific, and parts of Caribbean and South America. Most of infections worldwide are caused by Wuchereria bancrofti. In Asia, the disease can also be caused by Brugia malai and Brugia timuri. Infective larvae are transmitted by infected biting mosquitoes during a blood meal. The larvae migrate to lymphatic vessels and lymph nodes, where they develop into microfilaria producing adults. The adults dwell in lymphatic vessels and lymph nodes where they can live for several years. The female worms produce microfilaria which circulate in the blood. The microfilaria infect biting mosquitoes. Inside the mosquitoes, the microfilaria develop in 1 to 2 weeks into infected filaria form third stage larvae. During a subsequent blood meal by the mosquito, the larvae infect the vertebrate host. They migrate to the lymphatic vessels and lymph nodes of human host where they develop into adults. The symptoms begin to develop 5 to 18 months after a person is bitten by an infected mosquito. Most infected people have no symptoms and will never develop clinical symptoms. These people don't know they have lymphatic filariasis unless tested. A small percentage of persons will develop lymphedema. This is caused by fluid collection because of improper functioning of the lymph system, resulting in swelling. This mostly affects the legs but can also occur in the arms, breasts, and genitalia. Most people develop these symptoms years after being infected. The swelling and the decreased function of the lymph system make it difficult for the body to fight germs and infections. These people will have more bacterial infection in the skin and lymph system. This causes hardening and thickening of the skin, which is called elephantiasis. Many of these bacterial infections can be prevented with appropriate skin hygiene and exercise. Men can develop hydrocele or swelling of the scrotum due to infection with one of the parasites that causes lymphatic filariasis, specifically Wuchereria bancrofti. Filarial infection can also cause pulmonary tropical eosinophilias syndrome, although this syndrome is typically found in persons living with this disease in Asia. Symptoms of pulmonary tropical eosinophilias syndrome include cough, shortness of breath, and wheezing. Diagnosis. The standard method for diagnosing active infection is the identification of microfilaria in a blood smear by microscopic examination. The microfilaria that cause lymphatic filariasis circulate in the blood at night, called nocturnal periodicity. Blood collection should be done at night to coincide with the appearance of the microfilaria, and a 6-mer should be made and stained with Giemsa or hematoxylin and eosin. Serologic techniques provide an alternative to microscopic detection of microfilaria for the diagnosis of lymphatic filariasis. Treatment: patients currently infected with the parasite. Diethylcarbamazine is the drug of choice in the United States. The drug kills the microfilaria and some of the adult worms. Another treatment option is ivermectin, which kills all the microfilaria. Patients with clinical symptoms, lymphedema and elephantiasis are not indication for diethylcarbamazine treatment because most people with lymphedema are not actively infected with the filarial parasite. To prevent the lymphedema from getting worse, patients should ask their physician for a referral to a lymphedema therapist so they can be informed about some basic principles of care such as hygiene, exercise, and treatment of wounds. Patients with hydrocele may have evidence of active infections, but typically don't improve clinically following treatment with diethylcarbamazine. The treatment for hydrocele is surgery. Prevention. The best way to prevent lymphatic filariasis is to avoid mosquito bites. Another approach to prevention includes giving entire communities medicine that kills the microscopic worms and controlling mosquitoes. Annual mass treatment reduces the level of microfilaria in the blood and thus diminishes transmission of infection.